I'm an NIHR public advisor. I was involved in a research project evaluating public perceptions on how health and social care was provided to the public during the COVID pandemic. So who was involved? The team consisted of myself and 2 other public research advisors and a postdoctoral research associate from Liverpool University, having to qualitatively, thematically analyse interview transcripts from interviews conducted on the public. Right, challenges. A challenge that was probably evident during doing it was the timescale given to complete the project. Unlike myself, some of other public research advisors were fairly new to doing qualitative analysis techniques to thematically analyze interview transcripts. So I necessarily was fortunate enough to have experience doing this type of work before on a previous NIHR research project, and to be given the training exercises and how to thematically analyze interview transcripts. However, very little training was offered to other newly public advisors in the project due to the tight deadline, and this resulted in some advisors needing more time to analyze the transcripts and taking on less transcripts to analyze compared to myself. So that's one thing.
Do you mind if I ask a question, Jamie, just in the middle of that? Did it feel like a useful exercise analysing those interview transcripts? What did being a public advisor bring to that analysis?
It felt really a useful exercise, really. It felt as if like I've developed a particular skill, really, and it's grown, and that I'm valued, really, and yeah, I'd love to be even more projects to do with it. Yeah, really. I'm part of a project really to do with ARC North Thames, really, which is to do with analysing public's perceptions of artificial intelligence used in health and social care, really. And I'm actually having to qualitatively, thematically analyse transcripts, and the skills that I've learned from Northwest Coast has helped me develop it even more, really. So
that's really interesting.
Yeah,
I think as researchers sometimes we can feel a little bit reluctant to ask public advisors to do that level of work. It feels like a lot of work to ask people to help with, but you found that really
I found that I mean also it's brought up in a skill, really. I'm not really necessarily good really with my maths ability, so quantitative really wouldn't be really my skill, but my qualitative skills is really progressing, and that's what
and just one, if I can just ask one last question, do you think having let public advisors do the analysis, do you think you brought a different view to that data than maybe just the researchers would have done?
I felt that I was more involved in it, really, but it was just not something tokenistic, really, that we've got to involve public advisors because X, Y, and Z says that. I felt I was actually involved in the research, and I would like more projects to be involved in their for public advisors to be involved in the analysis stage, etc., and to give their opinions, really.
Thank you. Go on.
Because they can make a great difference to the project.
I was just going to say, I think sometimes within research projects, what can happen is we do a lot of consultation and involvement at the beginning of a research project to try and design it and work out what methods and recruitment and all of those kind of parts of a research project, but then sometimes less so for the analysis. So that's quite interesting. Maybe we should do more of that.
Yeah. So the next question was anything which did not work well? I feel as a team, we could have got more transcripts analysed, as we were only using Microsoft Word to thematically analyse the transcripts, having to manually highlight sections of the transcripts, add comments, which took some time. Even though it was enjoyable, it might have felt time-consuming to some public advisors. There's a specific piece of university qualitative analysis computer software that the university research academics use and have access to use, which cleverly automatically selects phases and etc. within the transcript and should be thematically analysed, making the process quicker. However, unfortunately, we weren't able to use this software, however, because it required us to have access to the university computer network and to use the software and like me to have the university computer administration rights to use the software and taken more time, especially given the types deadline and schedule. So really, in all honesty, what I would have rather happen is for us all to, there's a piece of software called NVivo, which the university can use really. And I don't understand why, if we're research public advisors, why can't we have the same access rights to use the same research resources that PhD students use, etc., to be able to use that software if we can?
That's a really good point. Yeah, that's a really good point, Jamie. And do you think every public advisor would want to use those kind of software? Do you think different people would have different ways that they would want to do it?
Different people will have different ways, possibly, but I think they would find it really beneficial, really, or even, you know, for them to have 1 day training session or something about how to use it, etc. You know what I mean? How to feature it, yeah.
Oh, that's really important, and I guess that would also work, wouldn't it, for people that are doing kind of the statistical studies, access to software that would help them do that if they're helping with those kind of elements of the research. Okay, that's really interesting. Thank you.
Yeah.
And then the next thing that we're asking, is there any kind of key lessons that you've learned through that kind of involvement?
Well, as a public advisor, I've been given the opportunity to undertake research analysis. There needs to be a training day, I feel, that's set aside dedicated to teaching and learning useful techniques on how to analyze qualitative and quantitative research data, even if it means public advisors getting familiar with how to use the research analysis software that the university research academics use. Yes, before undertaking any project, just one day where public advisors can go into the university or thing and just be taken through how to use the software and what to expect, etc. It just puts their mind at ease, really, rather than feeling anxious that, oh, this is something new. I've never done this. You know what I mean? You know, I'm being thrown in at the deep end.
And do you think that training? Do you think that training is useful for other parts of helping kind of shape research studies as well as just analysis? Do you think
for other stuff as well? Yeah, definitely. There's a lot.
Sorry, go on.
There's a lot more that I feel that public advisors can get involved in, and there's a big difference between, like, say, ARC North Thames and ARC Northwest, where they're featuring more public advisors and stuff, like being on steering board committees and etc. and stuff like that, while it seems to be a tiny bit limited in terms of Northwest Coast, really. So I feel that there is more that can be done.
Okay. No, I think that's really useful, and I think that's one of the things that we really wanted to highlight as part of these interviews, was like, what more should we be doing? It's interesting to hear you talk about analysis, which sometimes we don't always do as much as we maybe should. What other things do you think we're missing as researchers? Do you think what missed opportunities? are there?
Well, there could be opportunities for like public advisors to be on a particular steering board, really. So, for instance, when a PhD student has a new project that they want to conduct with ARC, really, why not have a public advisor representative to impose the questions? Well, how is this going to benefit the public? This, that, and the other, and so it can be more public focused rather than just guideline research focused on what NIHR specifies it to be, really.
Yeah. Oh, thank you. That's really good. That's really interesting. And so generally, you've got lots of experience, Jamie. One of the questions that we were really keen was finding out kind of like what do you think the biggest challenge is? You've talked about not being able to access university systems and stuff, but just generally, what do you think the biggest challenge is kind of facing us working in a meaningful way with the public?
Well, what I feel that to make things better, to ensure that the research topic areas are better catered to the public advisors and not having only generic criteria for public advisors to be involved in a research project, more generic health topics as projects that affect all public advisors within that region of England. As an example, I'm a public advisor that has a mental health condition of Asperger's syndrome and dyspraxia. But I've not come across any particular NIHR ARC research project that focuses on these health conditions, looking for public advisors to be involved. Yet it seems to be very, for instance, there seems to be quite a few research projects which seems to be covering like an area of like say dementia within elderly people, etc. That's okay, fine, but it doesn't give. It's difficult for those public advisors that have not got those, haven't experienced dementia, haven't experienced caring for someone, to apply for those particular roles, really. It needs to be a bit more open. And sometimes I really do feel that it would be helpful for the PhD student to talk to all public advisors, talk about what their condition is and what their health problem is, etc. And then to, based on that information, to devise a research project that meets their particular needs, really, within that area.
So that's turning it round then a little bit, isn't it, Jamie? Rather than researchers coming and saying, I want to do this project, has anyone got the lived experience to match what I want to do? Someone with that lived experience saying, this is the research that needs to be done, and finding a researcher to be able to work with them on it.
Yeah.
Interesting.
Yeah.
That would be a nice way to work, wouldn't it?
Yeah.
So as we kind of draw to the end of the interview, thinking about someone who has never worked with a public advisor before, what top tips would you give them?
I think that an introduction meeting should be set up before any research project is developed. A chance for the newly assigned researcher to ask questions to the public advisors about what health and social care topic areas interest them based upon their health and social care needs and intentions, as well as what research topics they feel is important to explore around the public members' neighbourhood community. Once this information is obtained, as I've mentioned before, the researcher can then develop a research project proposal that will involve members of the public, more tailored to the public members' health needs and intentions. That's how I feel of it. I understand that there's certain topic areas that NIHR ARC Northwest says you need to entail. I get it if it's to do with, like, I don't know, person-centered complex care, etc. And that's how you get the funding. But try to specify it more to what the public advisors problems are, really.
Yeah. And if someone had been, so if there's a relatively kind of new researcher and they've been given a topic and they have to try and find some members of the public to work with on it, is there a way they should go about that, or things they should really avoid saying or doing?
Okay. Say if it's a specific topic area, it's all right involving public advisors for that research project, but also what's wrong in this involving generic public advisors just to be involved in the analysis stage. Okay, public advisors don't need to have a specific skill of oh, I've had experience of caring, I've had experience of thing. Any public advisor can deal with the analysis stage or certain stages of the project, just to help out the PhD student a bit better, really. So it's not all that the whole burden is on top of that PhD student to make sure he or she reaches that tight deadline or schedule.
Yeah, and I think sometimes, Jamie, we worry as researchers about putting too much burden on the public advisors, but it from what you're saying, it should be a conversation to be had as to whether that is a burden or actually something that someone really wants to do, without us making assumptions that it's a burden.
Yeah. Well, it's of course it's entirely up to the public advisor whether or not, but giving the public advisor the opportunity to decide upon whether they would like to.
Yeah. Okay. Thank you so much. And thinking about, I've been involved in research for a really long time, and we've moved a really long way from how we used to work with members of the public generally since 10 years ago. In 10 years' time, how would you like to see that? How can we move forward working with members of the public? That's a bit of a tricky question, sorry.
One of the things I would like to do is again finding out their knowledge and skills, because some of these public advisors have got degrees, etc., or whatever. And what I would like really is maybe for them to improve their skills, etc. There's a lot of I know this is tricky, but there's a few courses on like postgraduate research courses, but I feel that would be very beneficial for public advisors and PhD students, etc. And to public advisors to be given an opportunity to undertake that course, to develop skills further, to further progress as a public advisor for more opportunities within ARC, and even further out, further afield to ARC North Thames, etc.
I really like that. I really like that idea, in that there could be kind of different levels, couldn't there? That someone could go as far as they wanted to, up to some kind of formal qualification. That's quite a nice idea.
Yeah.
Thank you so much. It's been really nice to speak with you. Really nice ideas that I think people could learn quite a lot from. So thank you.